morning. I'm Carrie. I'm a student from Southwest Tech studying for nursing. I'm here to check your incision and change your bandage for you today. Can you tell me your name and date of birth?
Wayne Cop, 3378.
Well, nice to meet you, Wayne. I know I gave you pain medication about a half hour ago. How is your pain now?
Good.
Good. I'm glad to hear that. Do you have any allergies to anything I should know about?
No.
No. Okay. So I would put this is my order that I have confirmed that I'm here for the bandage change. I would put this elsewhere. Next, I have my hand sanitizer here. I'm going to sanitize my hands. I'm going to check that I have all of my supplies necessary to do the procedure. So I have Wayne here in his hospital bed. I would make sure he is at about waist height for myself. I would have my table here at approximately waist height for this. I have all of my supplies here. I can check and see. I have my bowl here. It looks like it is sterilized and within date. My sterile towel here, also sterilized within date. My sterile pickups, also good. I have my sterile gloves that we'll be putting on later on. I have some gauze here for our procedure, which are also in date and closed, which is great. And I have my normal saline here that we'll be using for cleansing later on. Here I have the tape. So I should have everything that I need to start this procedure. So once again, I'm going to hand sani here, ready. I'm going to get my gloves out. So Wayne, I'm not going to get my table set up quite yet. I want to make sure that it is not opened until it's close enough time. We don't want to have the sterile field open too long because then it becomes not sterile. My skin and my clothes are not sterile garb, so I'm going to make sure that I don't touch my clothes or my skin once I have all of that set up, because only my sterile gloves that I'll put on later are sterile. Wayne, I would make sure that the curtain is closed for your privacy. I'm going to pull your blanket down here and just take a peek at your wound. Slide this up. Doing okay?
Yep.
Yep, okay. So I can see his bandage here. There's no seepage, no drainage out of the bandage. That is good. I'm going to hold some pressure on it. I apologize for your hair. And I'm going to pull the bandage off. I won't put this back on. I'm going to assess the bandage at this time. I see that there is a little bit of serous fluid on there, a little blood, nothing major though. I would call it minor. So this would then be placed into the trash can over here next to the bed. I'm looking at his wound. It looks great. There is no current drainage. It's not bleeding. It looks really great. Wayne, how you doing?
Good.
Good. Okay, fantastic. So we're going to go ahead and start setting up for the new dressing. After we've looked at it, everything's looking good. So I'm going to remove these gloves. They would also go into my garbage. I'm going to hand sani my hands again. So we're all ready to start getting set up here. So for this, my gloves are going to go on last. I'm going to go ahead and get my table set up first. So I'm going to start with my towel. So I would put my fresh gloves on now that my alcohol is all dry. Fresh gloves can be on too. So these are also not sterile, so I'm not going to want to touch anything too much with these. They're just for some added protection. So I can see here that this is my towel, so I'm going to hold it. I'm going to get my tape undone here. I'm going to start here, coming around this direction. I don't want to reach over the towel. I want to make sure that my hands are staying back here. We don't want to be reaching over top of anything. So all of this. I have everything exposed here now. So the 1-inch border around this towel is sterile, so I am allowed to touch the 1-inch border and only the 1-inch border of that. I want to make sure it does not touch my clothes, my skin, the bed, or anything else around. We don't want to shake it too much because that could contaminate it too. So we're going to keep it up here above waist level. Everything is always above waist level. So I'm going to get this guy undone here. So he's all unwrapped. He's ready to go onto the table. My table is also not sterile, so I just want to reach over top of this, get it placed here nicely onto the table. So now that's my sterile field that we're going to be working with. So once I have that guy set on there, I can go ahead and get my bowl ready. So here is my bowl. I'm going to do the same thing, still sterile. I'm going to unwrap it just like I unwrapped the other thing. My sterile bowl here is ready. Now the inside of this cloth is sterile also, so I can keep holding on to that while I get this over. I have the 1-inch border, so that is on there and ready for use. All of this is going into my garbage can over here because I'm not going to be using it. It needs to be out of the way. Next, I'm going to get my pickups ready. So my pickups here are sterile. I'm going to get my tape undone. I am opening him up just as I have everything else here today. I know there's some in here. There he is. So he's going to go next onto my table here. So I'm just going to flop him on there and he stayed. That is good. So these guys are going over here now. Next I'm going to go ahead and get some bandages ready. So my bandages are sterile. So once I open this package, I certainly don't want to touch the inside of the package. So I'm going to carefully open this guy up like this. He's all ready. Not touching anything on the inside. I don't want to go over top of that. I'm going to toss him on there. I can see that it is touching the table. My table is a little bit oversized for what I would normally be doing. He would no longer be considered sterile. I would have to start that over. For the purpose of the video, I am not going to start that over, but I am recognizing that it would no longer be sterile at this point. This guy would also go into my garbage can over here. For my next one, I'm going to get this guy all set and ready also. I'm going to flip him. He's on the middle. He's sterile. This also goes into the garbage. We need to save him though. So now I'm going to go ahead and get our water. I'm going to verify my sterile water 3 times before I use it. It is normal saline. It is within date. It is not expired, so that is great. Again, it is normal saline. I want to make sure that I confirm it 3 times before I use it. So the 3rd time, it is normal saline. It is within date, so that is great. In order for this, I'm going to go ahead and remove the cap. The cap we place over here, face up, so that way he doesn't get contaminated. We can continue using that. I'm going to keep the label in my hand like this. I would get about here and put just a little bit of water in there. Once I have the water in there, I'm going to go ahead and replace the cap. Now if I had splattered water any place outside of the bowl onto my sterile field, I would not be able to use it. Anything that gets wet is no longer considered sterile, so only in the bowl can be wet. But I did not spill any water, so we're still good to go there. I'm going to replace my lid. I'm going to just set this guy over here away from everything. So now I'm ready to go ahead and get my sterile gloves on so we can keep moving with our procedure here. So I have enough space here. I'm going to remove these gloves once again. They are going to go into the trash receptacle here also. I'm going to hand sanitize my hands again to make sure that we're not contaminating anything. Wayne, you still doing okay?
Yep.
Okay. Then we're going to go ahead and get the gloves set up here. Not the best situation here, so I am going to move my table just a little bit to have a little bit more room for these. But for this procedure, my hands are nice and clean now. I'm keeping in mind that my clothes and skin are not sterile. So I can go ahead and open my package. I can touch this package, but I don't want to touch the gloves or anything inside of it. So I'm going to get him set here. I'm going to open my package up nice and wide so to be sure that I don't contaminate when I go to put them on. I can touch these nice flaps that are here. Still haven't touched my towel. That's good. Then we're going to go ahead and put the gloves on. To put my first glove on here, I'm going to go ahead and grab this. This is the inside of the glove, so I can touch this with this hand. So he's ready. I am not going to adjust my cuff or anything like that. He needs to stay just as is. For the next one, I'm going to go ahead now. I'm going to touch the glove. I'm going to put these 4 fingers inside of here to get prepared. So he is all ready. I'm going to keep my thumb out here. Then I'm going to go ahead and get this glove on. I would not have my watch on for this procedure normally, or I would have slid it up, but he's comfortable there. I didn't touch my skin. I don't need to do any more adjustments. My gloves are good. So from here now, I can go ahead. My hands are clean, sterile, only my gloves are. I can go ahead and arrange my field here now. So I'm going to go over here and I can touch this area. These are going to be for cleaning. These guys here are going to be for the bandage. So I'm all set here. These guys, I'm actually going to throw them into my water here. So we're all good here. I'm going to grab my tweezers. I'm careful to stay above my waist. I would never turn my back to my sterile field in case someone else touched it. Came into the room without my knowledge, something like that. I certainly wouldn't want to turn around. So from here now, I'm going to put this guy in here. Now I'm actually going to go ahead and use this hand here, just in case if Wayne were to have a drain tube or something, if I needed to for some reason have a hand that I could break sterility with, I would want it to be the one closest to the wound so I wasn't crossing over. So I'll go ahead and do that for the demonstration purposes. These guys I'm going to have nice and wet in here. I'm going to make sure that I keep my arms up here like so, for the purpose of the gravity and water, and I don't want to get myself wet, but I need to make sure that my arms stay up here like this. So I'm going to go ahead and clean his wound here. Doing okay still, Wayne?
Yeah.
I know we're a little low, but he would be at waist level. So that's clean. I'm going to dispose of this into the trash receptacle. I'm going to do it a second time. This is nice and wet now. Don't want too much water. We don't want to soak it or leave excess water on there. So here's my next one again, so keeping my arms up here. I'm going to clean it again here now. And he's good there. This would also go into the trash receptacle. So now I'm done with my tweezers here. So I'm going to go ahead and put them here on this table. So I don't want to touch that yet. Next I'm going to go ahead and bandage. So both hands are still sterile. Still things are looking good. So I can go ahead and touch this. So I'm going to grab it here in the middle and I'm just going to place it over top of his wound just like that. And then I'm going to take the second one and I'm going to go ahead and place it on top also just like so. Not going to make it pretty, don't want to touch it, don't want to arrange it, everything looks good there. I'm done with my sterile procedure at this point. So at this point I am going to break my sterility. I'm going to go ahead and tape it on, but the wound is fully covered, so I'm just going to leave these gloves on, which is okay for this procedure. So I'm going to do this. As soon as I get this tape peeled, and I would go ahead and tape this on, but I'm not going to do that to Wayne again this time. So I would put 4 pieces of tape on there and secure it nicely, but I'm not going to do that. His hair, I would cover him back up here nicely. How you doing, Wayne?
Good.
Good. So then I could go ahead and remove my gloves here, put them also into the trash receptacle, hand sani again. So my procedure here is finished. Wayne, is there anything else I can do for you? I do have time.
Nope.
Nope. Okay. Then at this point I could finish cleaning up the rest of my procedures. I would get everything put away. I would do my documentation, and that would be the end of it. Thanks.